All right, today we're diving into a really interesting medication, one that kind of carves out its own little space in mental health treatment. It's called Bupropion. Now, you might actually know it as Wellbutrin or maybe even Zyban. And the reason we're talking about it is because it's just, well, it's different from most of the other antidepressants out there. So let's get into it.
So, right off the bat, here's the central puzzle we need to solve. How on earth can the same exact drug treat something like depression and also be one of the most effective tools for helping someone quit smoking? I mean, think about it. The answer to that question really opens up a whole different way of looking at brain chemistry, and that's exactly what we're going to unpack.
Okay, so to really get what makes bupropion so special, we first have to understand how it's not like the antidepressants most of us have heard about, the SSRIs. So on one side, you've got the household names, right? Prozac, Zoloft, they're all SSRIs. And their main job is to work on a neurotransmitter called serotonin. And they come with some pretty well-known side effects, like weight gain or sexual issues. But bupropion, it completely ignores serotonin. Instead, it goes after two totally different chemical messengers, norepinephrine and dopamine. And because of that, its side effect profile is often the literal opposite. And you've probably heard of its brand names, even if bupropion doesn't ring a bell. You've got Wellbutrin, which is mainly for depression and seasonal affective disorder. And then there's Zyban. Now, Zyban is the exact same chemical, but it's packaged and dosed specifically to help people stop smoking. It's a perfect case of one drug, a bunch of different jobs. So we've established that it's the odd one out. But how does messing with norepinephrine and dopamine actually work? What's it doing in the brain? Let's break down the chemistry. Okay, the official fancy-sounding name for what bupropion is an NDRI. It stands for norepinephrine dopamine reuptake inhibitor. I know it's a mouthful, but honestly, the name tells you everything you need to know. It stops the brain from reabsorbing, or kind of like recycling, two really important brain chemicals. Think of it like this. Your brain cells are constantly sending out these little chemical messengers. You've got dopamine, which is all about motivation and feeling rewarded, and you've got norepinephrine, which is about alertness and energy. Now, after they deliver their message, little recycling pumps usually swoop in and pull them back. Well, what bupropion does is it gets in there and it blocks those pumps. And the result? More of those motivation and alertness messengers get to hang around, which makes their signal stronger and last longer. But here's the absolute key to the whole thing. It does all of this while leaving serotonin completely alone. And that single difference is what gives bupropion such a unique personality, both for its benefits and, as we'll see, for its drawbacks too. And that unique mechanism, well, that's why this medication is such a Swiss Army knife. Because it's working on the brain's core systems for motivation and reward, its uses can go way beyond just typical depression. Officially, the FDA has given it the green light for three main things: major depression, seasonal depression, the kind that hits in the winter, and, of course, smoking cessation. And the smoking part makes so much sense when you think about it. It boosts dopamine, which helps satisfy that reward center in your brain that's screaming for nicotine, and that just crushes the cravings. But doctors have found other clever uses for it off-label. Since it boosts alertness and focus, you can see why it might be helpful for some adults with ADHD. It's also sometimes prescribed with an SSRI for the sole purpose of canceling out those sexual side effects we talked about earlier. And because it can sometimes reduce appetite, it's also used to help out with weight management. Now, all this talk about boosting alertness and energy, it gives bupropion a reputation for being an activating or stimulating antidepressant. And, this quality is a classic double-edged sword. On the one hand, the upside is amazing for some people. If your depression makes you feel totally exhausted, just wiped out, that activating effect can be a game changer. More energy, no sexual side effects, maybe even a little weight loss. But, and this is a big but, for someone whose depression comes with a lot of anxiety, that exact same stimulating effect can push them over the edge. It can make them feel agitated, jittery, and it can definitely mess with your sleep. It's a perfect example of how the right medicine for one person can be all wrong for somebody else. And that brings us to a really, really critical point. Because this is such a powerful medication, it is absolutely not for everyone. It comes with some serious warnings, and it really requires close medical supervision. So the typical maximum daily dose is strictly capped at 450 milligrams. And that's not just some random number. It's there for a very, very important reason: to minimize the most serious risk that comes with this drug, which is seizures. The higher the dose, the higher the risk, so that ceiling is a crucial safety guardrail. And because of that seizure risk, there are some groups of people who should never take bupropion. Obviously, anyone with a history of seizures, but also, and this is super important, anyone with a history of an eating disorder, like bulimia or anorexia. That's because the electrolyte imbalances that can come with those conditions can also seriously increase the risk of a seizure. And finally, you can't mix it with another class of antidepressants called MAOIs.
You know, this quote from our source material just nails it. Bupropion is an incredibly effective and versatile tool. It really fills a unique spot, giving a vital option to people who either don't get better on SSRIs or just can't handle the side effects. But it is not a medication to be taken lightly. It's a powerful key that has to be used for the right lock, and always under a doctor's care. And that kind of leaves us with one last big thought. A drug like bupropion really shows us that there is no one-size-fits-all answer for mental health. And maybe, as we learn more and more about the incredible complexity of the brain, the future is all about becoming better locksmiths, understanding each person's individual brain chemistry so we can find the exact, specific key that's going to work for them. Thanks for watching.